Tonsillectomy operation is a very common operation in children and in adults. By tonsillectomy, we mean a removal of the tonsils. The tonsils are normal inhabitants of the mouth. But when they are repeatedly inflamed, when it is so enlarged to interfere with voice or with swallowing, when there is foreign body in the tonsil or a small tumor in the tonsil, now we can say that an empty mouth is better than a bad inhabitant. These tonsils are usually found as a part of a defensive mechanism called the reticuloendothelial system, which is mainly the tonsils, the appendix, which you call the abdominal tonsil, and some patches in the intestines called the Peyer's patches. These usually develop at birth and become increased in younghood, and it is supposed to diminish and disappear at old age or at younghood. But when tonsils are exposed to bad atmosphere, to repeated insult like inflammations, like smoking and so on, they become a chronic tonsil which causes local and general symptoms. Local symptoms like difficulty in swallowing, rise of fever, and malaise and so on. And general symptoms other may cause rheumatic manifestations, may cause affection of the kidney, etc., 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 which is very rare complication, but it may happen. And at this time we have to consult a doctor, can we remove the tonsils or not? The tonsils will ask you, is it repeatedly inflamed more than 3 times a year? Yeah, okay. Does it interfere with swallowing or with respiration at night to give strong snoring at night or so on? Okay. If he has to decide to remove the tonsil, then he will remove the tonsil usually by many ways. At first, since many years, it was removed by a guillotine method called the guillotine tonsil. This was invented, or this maneuver was removing the tonsil with a special instrument called guillotine instrument, so rapidly and so on. But it was found to be somewhat have complications, so we now resorted to the dissection operation. We hold the tonsil, dissect it from its surroundings and remove it, and we have to ligate any bleeding vessels. Some modifications are introduced on this operation, like some remove it by laser. The laser is a sort of light cautery. Some remove it by electrocautery. Some used to remove it at one time by freezing operation. All these are modifications which does not interfere with the actual maneuver, which is removing the tonsil from its bed. The tonsils, when removed, the patient will leave the hospital within the same day or after 1 day. He has to take fluid diet for 2 or 3 days. Then he have to eat normal diet. He may suffer from pain in the mouth, pain in the ear, and difficulty in swallowing in the first few days, but all this will disappear by time. What are the complications of tonsillectomy? Nothing of this. Some very mild complications like pain after that, dysphagia, difficulty swallowing, and so on. Sometimes some bleeding may occur after tonsillectomy, which may occur after the operation, which is due to a non-ligating of one of the blood vessels. After 24 hours, it may be due to a strong coughing or, or so on, or maybe due after 7 days. This is due usually to infection in the bed of the tonsil, and in all these cases, the bleeding is easily treated by ligating the bleeding vessel and giving some anticoagulants to the patient. Now, is tonsillectomy a necessary operation for every child? The question is no. It is not a necessary operation for every child. Just like extracting a tooth. Is extracting a tooth necessary? No. The only offending tonsil is necessary to be removed. The only offending tonsil, as we have said, in the form of repeated inflammation, in the form of secondary manifestations like rheumatic fever or so on, this may lead to troubling the patient and may lead to complications. The age of removing the tonsil, any age. We can remove tonsils from age of 2 years up to 60 years. There is no age of limit for tonsillectomy operation. With a good anesthesia, When in a hospital, it is easily removed at any age. Now, does tonsillectomy interfere with fasting? Of course, yes. Of course, yes. We can delay tonsillectomy after the month of fasting. If it happens to be necessary to do, then we have to stop fasting for the first few days, because at the first few days, the patient will need to swallow fluids, will need to take drugs, will need to take the diet. Diet here is not only supplementary for the body, but diet is necessary to make the wound heal. The wound heals earlier when the diet is more. So I advise, number one, not to do tonsillectomy in the fasting month. Number two, if you have to do it for special reasons, we have to take few days, at least 4 or 5 days, not fasting, so as to give the patient a sufficient amount of fluids and diet. The patient who will do tonsillectomy at any time will note that the severest pain will occur in the morning. Why? Because during sleep, he will spend 4 or 5 days, 5 hours not swallowing food or water. And this makes the wound very irritable to him. So in fasting, we advise not to do tonsillectomy except if it is necessary. If it is necessary, I advise to not fast for 4 or 5 days of the operation. After that, he has to try himself. If he can fast with operation, well and good. If he not, he has to take his excuse. ومن كان مريضا أو على السفر فعدة من أيام أخرى. So God have given us the excuse in cases of emergency to stop fasting and to repeat it after on. I hope that we will enjoy our fasting this month, and we will stay in good health, and thank you very much.